Hi, I'm Virginia from PIF, the Patient Information Forum, and I'm here with Dan, who is the Quality Mark Manager at PIF. So today we're going to talk about what the Patient Information Forum PIF is, what the Individual PIF Tick is, the benefits of the Individual PIF Tick, how to sign up for the Individual PIF Tick, and we'll answer some of your questions.
What is the Patient Information Forum, or PIF? The Patient Information Forum is the independent membership body for people working in health information and support. We run the only quality mark for health information, which is the PIF tick. What does PIF do? PIF is a charity that represents and supports individuals, organisations, charities and private companies who create any form of health information. Our vision is that everybody has access to personalised health information and support to enable them to make informed decisions about their health, well-being and care. What is the Individual PIF tick? So the Individual PIF tick is a health information quality mark that says a person is trusted to create good quality information. It shows your health information has been created following our 10 criteria, which means it's evidence-based, it's accurate, it's accessible, it's regularly reviewed. It's just like the PIF tick that we have for organisations, but is open to individual content creators, not just organisations anymore. As I said a second ago, there are 10 criteria that you will need to demonstrate that you follow. I'll briefly go through these now, but there are loads more details on our website about them. Section 1 is about systems and process, and what we would like you to have is a written method for producing content that makes sure that you produce it to the same quality each and every time you produce something, so it's forcing that consistency. Training. Anyone producing content must have the appropriate skills and knowledge to understand and portray that information. Section 3 is the need. There must be a genuine need for the content. We don't want you to create things just for the sake of doing it. If something out there is good already, then leave it out there. If there is a need for your information, which could be you've spotted a trend in something that you want to answer, some misinformation, you're getting feedback from your audience around what they would like to see, what questions they've got, all of that demonstrates a genuine need for the information. All of your information should be based on reliable evidence. So our section 4 is all about that evidence. It must be up-to-date, trusted evidence sources that you use. You must explain any risks or uncertainties to your audience within that. So it could be it's a new piece of research that you're talking about and that it's only been found in a small number of people. It could be something that you have an interest in, but your limitations are that you can only go this far in it. That's fine as long as you are open and clear around the limitations and the risks. You shouldn't be producing any information that doesn't have some form of user involvement in it. And this is looking at your audience and making sure that you consider what they want in the creation of your content. So that could be the language that you're using, it could be the subject matter, and it's really useful to interact with them and get their involvement, kind of edge towards co-production. Section 6 is about health inequalities and accessibility. You must create content that meets the needs of your audience. So think about who your audience are. Are they predominantly from one ethnicity, from one gender? Is there things that might stop them accessing the internet? Is it that they might have sight impairments and therefore they're going to listen to what you say more than visually see it? So there's lots of different things to consider when you're doing this, but the main thing is that you think about your audience, you involve them, and you create information that's going to meet their specific needs. Section 7 is about transparency and legal requirements. So you must comply with GDPR, you must have conflicts of interest, you cannot promote any medicines, you must follow any local regulations that are in place depending on where you're creating that information, and you must be open and transparent about all of that. We like you to collect feedback on your resources, so that could be dealt with through comments, that could be through direct DMs that you get, that could be through emails. We want you to record all of that and appropriately respond to that. Now, that doesn't mean everybody that likes your information or sends you a note you have to respond to individually. But what it is important is that you get a general feel for how that piece of information was received by your audience. And if somebody questions you later about how well did it go, you'd be able to pull up some evidence to show that. The last two criteria is dissemination, and that's about promoting your information to maximize its reach. So if I cast my mind back to when I started doing this, a lot of things were in printed format. We then moved to websites and everybody was using Google. We're now on social media sites where, you guys are much more familiar than I am. How do you promote yourselves to make sure that people can find that information? So having a plan for each of your videos or your resources is really important. And Section 10, one that whenever we talk about, people kind of take a deep breath and go, oh, that's really difficult to do. We want you to measure the impact that you're having. Now, that's not having to do full impact evaluation for each and every video. It's about setting some targets for your videos and looking at how you can meet those so that when you review them over a period of time, you are reviewing them consistently. So this may be around the number of views that you get, pulled together with the level of feedback that you get. So if you've got sort of 80-90% positive feedback, you might think that's great, let's set that as a target. You might talk about something that's a little bit more controversial, so you might lower that and might say, look, I know I'm going to get a bit of complaints around this subject because people have different views. That's fine as long as you're clear about those. And again, this goes back to recording that feedback that you've got and monitoring that and using that in an appropriate way. So that's the 10 criteria. Some of them I'm sure you're probably aware of and already doing. Some of them may be new to you. Parts of what we do is to support you to get there. So don't be put off if there are criteria there that you're not already thinking about. So that's enough from me for a moment. I will pass back to Virginia to go through some of the benefits.
Thank you so much, Dan. So recently we had 4 health content creators qualified to get the accreditation of the Individual PIF TICK and become trusted information creators. So those were Dr. Azmain, Pharmacist Virginia, which is myself, Dr. Sophie GP, and Dr. Liz O'Riordan. So we all went through the full 10 criteria and had to submit evidence to show that our information creation process meets all 10 criteria. So I want to go through some of the benefits of the Individual PIF TICK for each of us. And the first person we'll go through is Dr. Azmain. And Dr. Azmain said, I think the PIF TICK pilot has really helped consolidate the way that I make content. There's just so much misinformation out there. I think this scheme really encompasses the fact that we're coming together as a community of health creators and championing high standards for the content that we make. Dr. Liz O'Riordan said, it has made me realise I want to tell my audience what they want to hear, not what I want to tell them. It has helped me make sure I'm using accessible words and language users can easily understand. It has also made me realise most of the content out there is never checked by anybody. Dr. Sophie GP said, by creating health information videos, I'm very efficient and I can manage people appropriately. It means I have got appointments available for the people who do need that consultation. I want the patients to be empowered, to have better engagement, but also it is about the well-being of staff. As a frontline GP myself, I know there are absolutely crazy pressures. I really feel like this is a great solution that I want more GPs to find out about and get on board with. And this is what I said when at the time I was doing the individual PIF TICK assessment. I wasn't part of the PIF team, which I am now. So I said, it's so helpful to go back and see my process documented and see what worked. I can then actually repeat that process again for more videos in future, which means I can have even more impact. So all 4 of us create health content on social media. So let's go through some of the benefits of the PIF TICK. So when you get your accreditation and become a trusted information creator, you get entry onto the PIF TICK directory, which is a place that people can go to find trusted information and the people that actually create that information. You also get access to best practice guidance for producing health information through our website. You also get exclusive access to member-only webinars and networking events where we invite experts to speak about topics like AI. You also get discounted CPD accredited training, such as the Writing Health Information Workshop that we run 2 or 3 times a year. You also get use of Ask the Membership and the discussion forum. So as a membership, we are a group of health information creators. So you'll be able to ask other individuals how they create their content, but also the organizations that are part of the PIF TICK membership. You get also discounted use of the sounding board for peer reviews if you want someone to take a look at your health information before you publish it. And you also get the PIF Aware weekly newsletter in your inbox every Wednesday or Thursday, and that will give you information on what's going on in the world of health content creation. With the PIF TICK accreditation, you can also apply to be part of evidence-based health information resources, including the TRIP database and HealthyNote by Cognitant. So Dan, would you like to go through how to sign up for the individual PIF TICK?
Yep. So to sign up for our individual PIF TICK, you can go on to our website. On the link provided on the screen, there is a very simple application form to complete that asks you sort of 4 or 5 questions around who you are. That application form will get sent directly through to the team here. We vet all of our applicants and approve them appropriately. As soon as you have been approved, you will get a notification back, and then you will get set up on our assessment portal, which will guide you through the various steps that you need to go through to become assessed. Now, I know something that's going to be really interesting to everybody is what is the cost. I'm sure that's the thing that dragged your eyes to this straight away. The fees for the scheme are £300. That's including VAT, and that covers all of the benefits that Virginia has spoken about and your assessment. That is an annual fee because we check what you're doing each and every year. So it's a very simple application process. It's a really good fee that we charge people for all of the benefits that you get, and then it just continues, it goes round each and every year. So it is a subscription that you'll be signing up for.
Yeah, and also to mention that the first time you do your assessment will be the most time consuming, but then after that it should be much easier. So it's less of what might feel like a chore in the beginning in your first year. It will be much easier as you go through it every year. And of course, the way that you create content in your first year might change. So we expect that to happen. So when you create a health content information process, then we don't expect that to be set in stone. You do have flexibility to improve it or change it so that it meets your needs as an individual. And we also understand that as an individual, the way you create content is going to be different to an organization. So it does align with the organization criteria, and it takes into account your kind of resource level as well. So in terms of answering your questions, these are some FAQs that we got during the live webinar, and we picked them out here so that we can answer them. And I'll read out the question, and then Dan, if you can answer it, that would be great. Okay. So the first question is the individual PIF TICK for freelancers who create health information for organizations or clients such as medical writers?
At the moment, the individual PIF TICK is only for people that create information in their own right. We are looking at some approval scheme or some recognition scheme for freelancers. If people are interested in getting involved in that and having those conversations, please do reach out to us, and we will be setting something up in the near future to have those conversations. But at the moment, it is for individuals that create content in their own right, using their own names and their own channels.
Thank you. So is the PIF TICK only for people in the UK?
At the moment, the PIF TICK is for UK people, but we are looking to expand that wider. We do have PIF members that are outside of the UK. So if you are interested in this and you're not based in the UK, do please drop us a line, because you'll definitely be able to be a PIF member, and you may also be able to be a PIF TICK member by that point.
Thank you. How will creators be accredited over time? What is the plan to prevent drift of content standards?
That's a great question. What we do is we assess you each and every year. Like Virginia just alluded to, your initial assessment for joining the scheme is all about setting your processes up, supporting you to get from wherever you are now to a point where you understand the 10 criteria and are working towards them. you would have a similar assessment each and every year thereafter. And that will always be about looking at where are you now? What's your process doing? When we're at a point that both you and your assessor believe that your process is as good as it's going to get, there are no more improvements that we would like to make or you would like to make, we will start to then look at your content itself and do information assessments where we will take examples of maybe podcasts that you do, YouTube videos, blogs, and we will go through them and we will check feedback from your actual audience, as well as how has this been created following whatever consistent method you have. So there's no opportunity for you to kind of go, I've got the certificate, I can do what I like. We are working with you ongoing throughout your life journey with us and the PIF TICK.
Thank you, Dan. So the next question is, if I do not have a process I use to create health content, can I still apply?
The simple answer to this is yes. What we like to do is actually get people that are wanting to improve, that maybe aren't sure what the right way to do things is. The earlier you work with us, the more support and help we can provide you. If you've got a good, robust process, your timeline for getting through the assessments and accreditation with us will be shorter. But if you haven't got anything, part of our assessing role is to support you to get there. We have experience of working with different content creators, small charities, large charities as well, and helping them develop a process from something that's probably in your head but not documented to fully documenting that in a way that's not going to slow you down, that's not going to add bureaucracy. It's about helping you create videos in that consistent way. So yeah, join wherever you are on that journey of I've got a process, I'd like a process, I kind of got a known process. We're happy to support with all of those.
Thank you, Dan. So is there a discount for students or new health content creators?
We have priced the scheme what we feel is an appropriate fee. However, we are open to having those discussions for individuals, and they'll be taken on a case-by-case basis, but there may well be some discounts for people that are just starting this or that are students at the moment. So yes, there is a possibility.
So do you need to be a doctor, nurse, pharmacist, or other healthcare professional to apply? What is an expert?
Various different schemes will define experts quite differently. We say in our criteria that it has to be vetted by an expert. Now, that expert could be a doctor, it could be a nurse, it could be a pharmacist, it could be a physio, it could be a therapist. You will need to define what those experts are. What we are saying is that you cannot just be a lay person going, I'm really interested in this and this is what I want to say. There needs to be that level of expertise to sign things off. Now, you could be a patient expert yourself and you could create all of this content. You would just need to find resources that support what you're saying or an expert to support that as well. So it's very much down to individual situations of what subject are you talking about, and being an expert in that subject. You don't need to be an expert in all subjects.
Yeah, and you could also have an advanced degree or you've done a specific research project or something like that. So more than one expert is great if you can.
Yeah.
So for content that has already been created, is it the channel that will be accredited or the content creator?
So we accredit the process that you go through to produce information. So it's kind of somewhere in the middle. As the content creator, as long as you follow that process, that piece of information can have the logo on it. Now, if you've got already existing content on a channel, you might be able to go back and say, I followed the exact same process as what's been assessed by the PIF team. I can put that on there. Most cases, there are tweaks to the process from what you used to do to what you will be doing going forward. So it's best to kind of review that information in line with your new process and then put the code mark and logo on it moving forward.
Thank you, Dan. So what if my health content is mostly opinions and there is very little evidence at the moment?
As long as, like we said during the criteria, you are aware of that and you speak about the limitations and the risks and the unknowns with that, that is fine. I mean, there was a lot of content that came out when COVID hit. Some of it great, some of it misinformation. As long as you've got some of that evidence, the latest evidence that you can get your hands on to show what you're talking about can be backed up, then that is fine. If you are a healthcare professional and you are giving your opinion, you will need to get that approved by somebody or peer reviewed by somebody else. We need to make sure that we are addressing the mis and disinformation that is out there. So it needs to come from that reliable, trustworthy source.
Yeah, and if it is just your opinion or there isn't very much evidence, then just make that very clear to your audience so that you are not misleading them or adding to the misinformation and disinformation that's out there. Thank you, Dan. So, final question. Does the definition of patient extend towards the public in general?
Yeah, I mean, a patient as we define them is anybody that could find the information that you are producing helpful. Most of our membership is long-term sufferers, and that's why we use the term patient. But actually, it's anybody out there that will find your information, can help them make a choice about their well-being, their lifestyle, health decisions that they might have to make. So it's a very broad term when we use the term patient.
Yeah, thank you, Dan. And then also, it's good to keep in mind that not every person who has a health condition identifies themselves as a patient because they have good control of their health and they're able to live a good quality of life that they're happy with. And that's what's important. So if you do have any questions that we haven't covered here today, then please email us at info@pifonline.org.uk and we will answer your questions. Thank you so much for watching or listening today. And you can watch the full interviews of Dr. Sophie, Dr. Azmain, myself, Pharmacist Virginia, and Dr. Liz on our YouTube channel at PIF-Patient Information Forum. Thank you so much, and we will see you soon. Bye.
Bye. Thank you.